Good evening, this is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk a little bit more about rotation of teeth. This is something that's a pretty big part in orthodontics, and we're not just talking about rotating a tooth from the occlusal surface. You can rotate that a certain way. We've shown you different ways, but you can take a tooth that's, say, laying down like such, and roots coming down here, and you can come in and another tooth may be up here, and you want to pick this tooth up. This also is rotating the tooth from the side. In other words, we're going to take this whole thing and just rotate this tooth up, and that's what this video is to be concerned with, is rotating from the side of the tooth. You have to get on the side of it to do it. Over here you wrap something around it and have the arch wire coming up here, and you can pull this tooth around and rotate it like 160 degrees if you want to. You spin it completely around if you really wanted to do that, but we won't get into that today. All right, now this rotating from the side, I'm going to show you this beautiful young lady here that had this impacted, there's partially impacted cuspid teeth. Now this is done, we started this in 1973, got her in. She had a lot of fluoride in the tooth structure, and you can see the little spots in the teeth here where there's excess fluoride, but they just don't decay much. So you can go ahead and work on these teeth and you'll have very little decalcification. And back then, in 1973, we were using bands on everything. So I'm going to have to show that to you. Let me pause here just for a second. I'm going to Okay, we're back in business, I think, here, and we'll go ahead. As we said, this was a case we did in 1973, and we had nothing but bands then to bond on the teeth. I didn't have any, there was no, didn't know about etching and bonding material stuff. Then we were did some, but not, you just bonded acrylic on to a tooth. But anyway, let's get back to the case itself. So let me see now. I've got to come back over here and click my little arrow. Okay, we put separators in. And those separators are still a good thing to use. That's just because we used them back then. They had little springs on them, and you snap those down between the teeth, and they were excellent separators. And you can take them, sterilize them. You don't have to make new ones for every case. That's ridiculous. So you can sterilize them and use them over again if you want to. And I've never lost a one in anybody doing this. And we had a excess crowding in the case, and so we extracted some bicuspids on the case. In 1973, they extracted a lot of teeth, but we would still probably want to extract teeth on her. Now here we're opening the space between the 6-year molars and the second molar and the bicuspid, second bicuspid, which is left, and we'll go through this pretty quick. It's not just trying to do orthodontics here, but this is what we did. We had the bands with the twin brackets on them, and you could tie the sides down and rotate the teeth. They were pretty good. Now I'm using 018 bracket slots, and that'll be 018 is the largest arch wire I can put in there, say an 1825 arch wire, which is something like, it's 18 in this vertical dimension and 25 in the horizontal dimension. And we do most of our cases in a 1725, which is 1,000 smaller, which it gives you a little bit of slack up here, but that knocks off a few degrees in torque also. So anyway, this is done with 018. That's an 018 woven arch wire there we were using then, and they're still good. And so we go on here, we're moving the cuspids back and kind of making room for them, and with like this bicuspid is quite different from this one, so you got to kind of compensate. You may have to strip this one a little, make it match up with the other. And here we banded all the teeth. We went through the case, and it worked out real well. And I got right down to the end of the case, and we had moved the back teeth up to fill in this space where we took out the first bicuspid. And we had a little additional room back here. In fact, you've got room enough in her jaw to put a couple of teeth back there, it looks like. And so I did not want to lose this tooth right here. I wanted to get it back in there. I wanted to raise it up and just set this tooth back in this area right in here. And so there was no, we had no bonding material. If I'd had regular bonding material here, I could have bonded a deal on the side of this tooth right here, and then you'd make come out here and make a deal like something like that, and go down here, and you'd bend it where you could hook it onto the arch wire over here. You'd have to kind of close in like that, and you'd raise it up, put it over there, and it would tighten that rut, and that would push this tooth out. And that we do that all the time now, and that's the way we're going to recommend you do it. But let you know that we figured this out back when we had no proper bonding material. So I knew that I had to operate this from the side, and so we built a little wire here that went up and went in here, and we bonded this part to the teeth here by etching the occlusal surface and putting acrylic powder and liquid in there. And just my bonding material was strictly just regular acrylic powder and a liquid, and you just had to keep it off of the tooth up here. It never would work. So we made this little wire, which I'm going to show you here in a little bit, and there's the tooth sitting down in that hole. And we bonded it before we had the bonding material, the proper deal. Here is the little wire. I'm sorry I sent this in for a picture, and this end goes out here, and we had a little curl on it so that we stuck this in the occlusal surface of the tooth with something, well, I'm looking at it wrong there. This was the occlusal, and it was down in here. We put bonding material on that, and this other tooth was right up in here over going this way. And we had to keep this material from sticking to the first tooth, the second molar, and we're going to have to raise this tooth out. And so we made this, and then we cut this little wire with that, pushed this, went way down like this, you see. And let me show you how it works. And you can still use this method if you like to. It's better than a lot of them I see. Now, we took that while this was tied off, stuck it in here, etched it, dried it, and put acid in there, and then washed that out, and then put this down and put a liquid acrylic over it with a little tiny brush, and let this acrylic harden good. And then I took this tooth, right here, brought it up, and actually I just laid it in here. And so as this tooth straightened up, it moved backward, and this wire will just slide back on these teeth. Now, if you think this is an old method and you got better, this is still not used. There's not a lot of people do this. You can upright or rotate, if you want to call it rotation, this way, or just picking the tooth up like this and uprighting it. You can do this to any tooth you want to. And it doesn't have to, the age can be anything. From as long as they've got some good bone structure and teeth, you can come in and just bond a little wire on about 3 or 4 teeth in here. Just put a little composite and bond it in there. It doesn't have to be really strong. And make a wire like this, come up behind one of your bonds and put the little hook, and as the tooth moves back, this will slide back with it that way. And you can just upright any tooth. Now, I really think that every dentist, I don't care where you go to dental school, what many deals you've got behind your name or anything else, you ought to know how to upright or side rotate a tooth. I mean, there's no sense at all in putting a bridge on a tooth like this. You can just set the thing up so easily. You don't have to have braces or anything. You just get something that's got a little tube on the side and bond it onto the tooth right there. And then just make you a little wire that comes in there. But I like to use rectangular wire, and then we run this wire down here, and we'll raise it up and hook it onto a tooth down here. And that'll pick any tooth, I don't care how old they are or anything. I mean, this ought to be taught to every dentist. If you go through dental school and they didn't teach you that, somebody cheated you. So you can come over here and learn it from this. I hope to goodness. Now let's watch in this case, and I'll show you what it actually does here. Okay, there it is, bonded in there. Now you don't use this. It's so much simpler just to stick a little tube over here and bond it on it. Stick the wire in the tube. You don't have to mess with this part here, and it'll pick up any tooth. I'm choking up here. Don't grind the tooth off above, afraid, oh, it's going to run into that and it won't set up. Just let it go. It'll push the tooth up. They'll bite on each other and push it down. So let me show you. I'm going to run through this pretty fast. Well, you can see the tooth is already straightened up over here. And there the tooth is. After wearing this thing for maybe a couple of months or something like that, we took that tooth and brought it right up, and then you can pull forward on it and close the space. It usually leave a space back there. Well, there it is, and we're going to band it, so we put a separator in there, and we put a band around that tooth. There's the one that was back there. Here is the second molar and the first molar right here, and that's worked just beautifully well, bonding it to that. But nowadays you've got tubes and stuff. You can just stick them on the side of a tooth, and you can upright or rotate, if you want to call it side rotation, any tooth in anybody's mouth. And you don't think, don't tell people, well, your bone is settled and it won't move and it won't do this because you're 25 or 50 or 60 or 90 years old. It'll move as long as you're living. If you've got root in the bone, it'll move. And here that tooth is, and there we're looking at it. That's a mirror stuck in here, so you can see this was that tooth that was sitting down in here like that. And we picked it up, and then we put a band on it and banded these teeth and closed it in. And it is so much simpler to bond the deal on the side of them and make it little all you have to do is just take a wire and make a little twist like that, and come out here where you're going to, you can just bond the wire on about 3 teeth out here, and hook it behind one of the bonds, because the tooth is going to move back, and you want your hook to be able to slide back from where you bonded it on there. So let's get on to, and here we finish this young lady up. When we had bands, somebody was asking me the other day, well, isn't it better to do bands? Well, you had to guess that. You've got two, let me go back here and show this where it had bands. I've got 2 layers of metal and 2 layers of cement between each of these teeth. And there's no way under God's heaven you're going to keep that from having a space. And you're going to take these bands off of the teeth, and you want to put something back here. We used to take the bands off the teeth and leave the molar bands, and we'd hook elastic and wear it from tooth to tooth, from molar to molar. And all this space is closed up. And you just say, oh God, I hope this thing looks nice when the space closes up. When you've got brackets, you stick the brackets on there. You can put the teeth together. You're going to put them just like they're going to be. And you can bring the parent in and say, this is the way it's going to look. And then you can take it off and it'll look that way. But here you had to make it stick out more, and then as you close the space, it would close something like that. So anyway, I've got way out of the picture out here, I think. Must have moved my camera, but anyway, it opened, it does the same thing. So anyway, I want to get to the end of this, and here we'll go. Now we've got this tooth that's lined up. Now we finished closing all the space on the young lady. And this was 19, and here that tooth was when we started, and that tooth went up just like this, and she had plenty of room for it. This one over here took me as long to get it up as it did to get this back into place there. I don't think we're showing the deal like we should. So I'm going to close out here, but there's the tooth after it's straightened up in the mouth.